Hey Health Junkies, Dr. Kraus here. Just wanted to jump in and let you know about a new feature that I'm adding to the podcast. It's the ability to ask me questions. I've had a ton of folks tell me that they would love for me to cover their questions on the podcast, so I'm going to do it. So each week I will be adding a couple of questions that I'm going to answer to each of the podcasts. And if it's a juicy enough question, I just may dedicate a whole podcast to it. So if you're interested in asking a question, head on over to my website at drjkrausnd.com. Check out a blue button on the right-hand side that says Ask a Podcast Question. Hit me up there. Or you can also access the button through my podcast notes, also on my website. So head on over there, ask me some questions. I look forward to answering them soon. All right, let's get on with the podcast.
Hey, Health Junkies. It's time for The Health Fix. Join your host, Dr. Janine Kraus, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello, Health Junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Kraus. In today's episode, I am really excited to have you hear my interview with Dr. Dan Engle, all about traumatic brain injuries and his experience with his own traumatic brain injury and how he helped himself by becoming a chief investigator and an experiment of one individual to find out what really worked to help him to recover all of his brain. And so one of the big things that I have to talk about with this podcast is that unfortunately at the beginning of my interview with Dr. Engle, I didn't press record. And somehow I ended up recording the second half of the interview, but not the first half. So I am going to start this podcast out in explaining Dr. Engle and his story and how he got to where he is now with helping folks to recover from traumatic brain injuries. Dr. Engle is a practicing medical doctor in psychiatry and neurology, and he has a wealth of information. I can't wait to get to the part of the podcast that I actually recorded. I'm so sorry, folks, for this error. But nevertheless, let me dive into a little history on Dr. Engle. Everything began for him about 2 weeks before he started medical school when he was on vacation down in Texas and he dove into knee-high water from a 20-foot pier. He fractured his C5, so cervical vertebrae 5, and ended up with a host of symptoms. After that, he was in a halo. He had a lot of recovery from there. But if you look back prior to that, he had also had a huge history of playing soccer. He actually played for the Junior Olympics team in 1989, which is super cool. But he took a lot of hits to his head. So heading the soccer ball multiple times over 16 years, that puts a lot of strain on your brain. And so that compounded with his C5 vertebrae fracture, he ended up having a lot of traumatic brain injury symptoms. So that being said, I want to pause here for a second and ask the audience to think about this. How many times have you clocked your head? Maybe you slipped and fell and you bumped your head. A common one that I hear for a lot of folks is they slip in the bathtub. A lot of ladies are shaving their legs, they slip in the bathtub, conk their head. A common one that I heard a lot in Colorado is falling and hitting the head on really hard snow, so ice pack snow. Super common for skiers. Another biggie, my husband used to race mountain bikes, endoing on the bike and whacking the head pretty good in that respect. And there's some actual data in terms of bicycling being one of the main sources of traumatic brain injuries, and a big deal because my husband did end up falling off his bike after being hit by a truck, and we'll talk about that here in a second, how that plays in. But really, I want you to think about how many times, you've had dingers or concussions in this case, and you didn't do anything about it. And if you look back, you're kind of thinking, wow, my brain seems kind of broken. I have difficulty concentrating. I'm moody. I get frustrated easily when I can't think of words. And I tend to blame it all on aging. But guess what? It might not be aging. It might be the compounded effect of all of those clocks to the head. I see this commonly with boxers, Muay Thai fighters, guys who like to spar in the ring. Maybe they don't compete, but they are training as a sport for themselves just to stay in shape. I have heard multiple of my patients have, I got a dinger last night, or I got my clock rung last night, and I'm a little nauseous, but I'm good. No big deal. It's this idea of not wanting to make a big deal out of having a pretty good brain injury that tends to get us in trouble. And I'm so glad that Dr. Dan is speaking out about this, because I think there's a stigma in terms of looking weak by saying that you don't feel well, you're not yourself when these things happen, and it prevents you from getting the care that you need. So that being said, the reason I really was psyched about Dr. Dan wanting to talk with me is because I have personal history with my patients and personal history with my husband in the case of concussions. So when I first met my husband, it was probably like 2 to 3 weeks after we met. We were ripping it down the mountain in Breckenridge where we lived, and probably he was showing off to show me how great of a skier he was. But he didn't know that if he already had me, it was okay. But he had to show off, and he jumped off of a cat track and fell at the end of it and whacked his head really good on some hard snow. And he popped back up, acted like no big thing was going on. But then he got a little wobbly, and then we stopped. And I was like, hey, are you okay? Man, you took a good hit. And he was totally confused. He had no idea what day it was, nothing. And of course, I'm, doctor at that point. I jump into doctor mode, and I'm like, what day is it? What time is it? Who's the president? And he's totally confused, doesn't really know, and tells me, yeah, I'm kind of nauseous. I feel like I could throw up. Yeah, I don't feel so good. Let's get down the mountain. So we get down the mountain, we go and sit in the lodge kind of area, and he's just kind of chilling there, and he's looking out of it. But I gotta be honest, I've not known this guy more than 3 weeks. I don't really know, is he embarrassed and that's his reaction, or is he really not doing too well? Of course, my doctor self is like, wow, this isn't good. He doesn't know what day it is. He's really confused. He's feeling nauseous. I'm like, this is not good. Now, he never lost consciousness, so in my head I was like, okay, well, he probably doesn't need to get a CT or anything of that nature. So I thought, okay, let's just go home. We'll get him rested. I'll watch him, observe him, make him some chicken noodle soup, and call it a day. And that's what we did. And we never did anything from that. Now, fast forward from that time frame, I met my husband in 2008, and this would have happened somewhere in January 2008. He then went on to be a mountain biker and had multiple wrecks, probably on a daily basis, that he wouldn't tell me about, because every time I went out on a mountain bike ride, I would wipe out. So there you have it. But anyway, he wrecked quite a few times, and then we had the big one, where in March of 2012, he was hit by a truck while riding his bike to work. Now, he tells me in that accident that he never hit his head when he came down. But we have some very huge factors that, if you look at it, a lot of his symptoms really, really did correlate with traumatic brain injury types of symptoms. And it didn't dawn on me. It really didn't even hit me till much later in 2014, when I went in, no, it was 2015, when I went in for his deposition for the court case based on his injuries. And really what hit me is we were talking about his symptoms after the accident with the truck. And yes, he had a headache. Yes, he was confused a little bit. He knew where he was in day, but he just was off. And that was in the moment. I was more concerned about his leg and the injuries he had sustained to his leg at that time. But fast forward to later on in 2012, after that, he wasn't able to enjoy life anymore. He was depressed. And yes, losing the career of mountain bike racing and things of that nature and not being able to do what you love is one thing. But unfortunately, when I was in that deposition, I realized that, holy cow, it's possible that my husband really was experiencing symptoms of traumatic brain injury. And the reason that I went down that route is because after his accident, he couldn't focus well on what he wanted to do. There was a lot of prodding. There was a lot of me kind of cheerleading along the way. And unfortunately, I think that his macho-ness, wanting to be tough, wanting to be a tough guy, really got in the way of me looking at it, and possibly me not wanting to see it either, that actually his symptoms of difficulty concentrating on a task, completing tasks, thinking through things, really were signs of his brain healing and his traumatic brain injury. And now, fast forward to modern day, 2017, he has completed a master's degree. He's done quite a few different things, and he's more on track in terms of what he wants to do with his life and how he's going to do it. And so just looking back at that and reading through even the first chapter of Dr. Engle's book, I'm going, holy cow, yes, my husband probably did have a traumatic brain injury, probably still is healing from it at this point. But the point being, the reason I'm sharing this story with you is that so many people blow off their symptoms. They try to be macho. They don't want to tell anyone that they're not who they used to be. I mean, Dr. Dan says it best in his book. There's nothing like the experience of not knowing who you are, where you are, and why you're there. And I'm pretty darn sure that when Joel hit his head that day on the mountain trying to impress me with his sleek skiing skills, he felt that. Now, I've seen this in my patients over and over again. In fact, I had a patient who was a former NFL player who couldn't get his shit together, as he told me. He just lost everything secondary to alcohol abuse. He just couldn't think straight. He lost his marriage. And 25 years after his last game in the NFL, when I started to see him for acupuncture, he was still struggling. The glam and bling of the lifestyles of the rich and famous NFL players that you see on like MTV Cribs, not happening. This poor guy was going to my low-income clinic and literally told me he's a shell of his old self. And in this case, this dude, I mean, total explanation of what happens to a lot of NFL players. And, you know, that's been brought up over and over again as in terms of what's happened to these folks with the multiple blows to the head. And I worked a lot with this fellow with acupuncture and trying to get him to function a little bit better. And I do believe it helped. But something just to put out there, that this guy spent 25 years of not knowing why he wasn't getting back to himself and couldn't think straight and couldn't progress and stick with a job or stick with ideas that he had. So there you have it. Now let's go back into Dr. Dan's story. By his third year of medical school, he was diagnosed with narcolepsy and post-concussive syndrome. He was given a stimulant medication, which he thought was awesome, but ended up getting hooked on it. And this is something that I found with multiple patients of mine in the traumatic brain injury universe. They get these stimulant medications. They're like, yes, this is great. But then it leads into other stimulant needs and it kind of spirals out of control. So Dr. Dan realized this and he went on his own personal pilgrimage to figure out what the heck was going on and how to get through the fog and fatigue and the helplessness. Because I find that a lot of my patients in Colorado and presently in Washington are feeling helpless. They don't know what to do. The medications that they're given, either the side effects are not pleasant or they don't want to get hooked on certain medications. And so I love that Dr. Dan is showing what he found that worked and all of the great ways that he went about it and how to stack different treatments on top of each other to get the best results. Now, some data for you. 3.17 million Americans with traumatic brain injuries have long-term disabilities related to that traumatic brain injury. That is a huge number. And I would actually agree in terms of all the different folks that I've seen in that realm too. Gosh. And one of the big things that's hugely important is that 3.17 billion, I'm sorry, not billion, but million, doesn't account for the undiagnosed, and in particularly in the military. I am here in Tacoma, Washington, close to JBLM, known as Joint Base Lewis McChord. Ton of folks with undiagnosed traumatic brain injuries. And in Dr. Dan's book, he estimates that greater than 4%, well, not him, data, let's put it that way. His data is greater than 4% of the 5.6 million folks in the military were diagnosed with a traumatic brain injury between 2000 and 2011. I think that number's low. I think there's a lot more. And unfortunately, it's because it's not diagnosed, because we have this society of, we want to appear that all's good. We want to be like, I'm fine. It's no big deal. I can push through this. But in reality, a lot of folks are trying to push through traumatic brain injuries, and they're not doing that great at it. They're not thriving in life. So that being said, these lasting traumatic brain injury symptoms are huge to pay attention to, because they limit your personal function and your enjoyment in life. Because we have a lot of folks that unfortunately are given antidepressants to deal with their apathy in life or their failure to become something. And really, it's not that they really have the depression or apathy. It's a broken brain. It's the brain injury that is provoking this. Now, we also have cases of aggression and psychosis and mania and anxiety that are also going undiagnosed. And sometimes folks are given medications that don't necessarily work for them. And when they're not getting better, they just become more and more hopeless. And this is huge. If you have difficulty concentrating, you have issues with thought process, with memory, with communicating how you feel, and expression of words and finding words. Also, if you have mood swings and you're having heightened senses or decreased senses, so your vision's off, your hearing's off, your taste is off, these are all signs of traumatic brain injuries. And so keep these things in mind. If you know someone or you yourself have experienced a good clock to the head, and maybe multiple of them, or been in a sport where you've hit your head multiple times and you're starting to wonder why your brain is broken, it could be because of a traumatic brain injury or compounded traumatic brain injury. So keep this in mind. I really want folks to take this as a part of my series where I was talking about how we break our brains. And a lot of times it's traumatic one event or compounded events that create that brain injury. So in Dr. Dan's book, he's talking all about what to do to fix your broken brain and all of the different neuronal connections. So what's happening in your brain, in a healthy brain, and what gets broken in a injured brain. And he's focusing on nerve growth and how to repair the nerves. He's looking at inflammation, how to reduce inflammation in the brain, since that's a big issue with broken brains. He's also talking about how to increase circulation, so get blood flow and oxygen to the brain, because that's a biggie. Also, the scarring and protein tangles that occur in the brain as a result of these injuries, how to get rid of those. And also how to improve your communication between your cells in your brain and your body. And this is huge because a lot of people suffer with coordination issues as well and don't often think of it as being an issue associated with the traumatic brain injury. Also, a lot of addiction issues come out of multiple brain injuries. So something to think about there. Now, Dr. Dan was talking all about the alternative treatment therapies such as hyperbaric oxygen, stem cell therapy, cryo, so this is cold therapy, cold laser, also near infrared laser in addition, and phototherapy, so light therapy, when I realized that I was not recording. And so at this point, Dr. Dan is talking all about nutritional therapy and the good fats and the type of diets that are most beneficial for a broken brain and traumatic brain injuries. And so I am going to let Dr. Dan take it away from here in his own words. I sincerely apologize that I goofed up and did not press record when I should have. I hope that I've given him justice in terms of explaining his book, and I really hope that all of you take this podcast as a thought process in terms of helping you or helping others or anyone that you know out there that might be displaying symptoms of a brain injury. And if nothing else, tell them, hey, it's okay. We don't have to be macho. Sometimes our brains break, and it's not always because we're getting older. So without any further ado, I'm going to let Dr. Dan take it away and get started talking about nutrition with you.
Locked in at whatever level is available to them. And when they're putting in baseline protocols, for example, nutrition, we get into ketogenic diet, the importance of staying away from sugar, moving towards an available free-form amino acid-rich diet. So for some people, that's going to be more of an omnivore or carnivorous diet, like a paleo approach that includes animal products and meat. If vegans are using this approach, I was raw vegan for 5 years, so I understand the orientation towards veganism, but I also understand the limitations the vegan diet has for people who are healing the brain, because we really need to have free-form amino acids, branch-chain amino acids, and the available fat-soluble vitamins like A, D, E, and K in order to up-level cognitive restoration. So those are just kind of examples. We get into light therapy and what it means to be like out in the sun, transdermal absorption of UV and vitamin D optimization, as well as low-level laser therapy and cold laser therapy that gets into the different light spectrums for up-leveling wound healing and repair. So there's a lot of different orientations around like the primary tools, and we break down those, and that's just in chapter 1. And then in chapter 2, we get into more interventional therapeutics like hormone replacement, what it would mean for somebody to be interested in stem cell therapy and the variety of different stem cell therapies. That's a whole nother accelerated area of medicine that kind of changes and evolves on almost a monthly basis. And acupuncture and qigong and sound healing. And so there's a variety of different options and availability for people to come in at different levels, really tailored towards their own curiosity as well, because a lot of people have heard of some of these therapeutics and they may be already inclined to one or more. And then when they know, again, where their symptoms are, what they're targeting, then bring in an associated technology or therapeutic, or maybe 2 or 3 at a time, and then follow that for a good 30 to 60 days and see if it's actually helping.
That is absolutely, obviously right up my alley, being a naturopath, also being an acupuncturist, hearing all this. I'm like, yes, this is exactly what I want people to hear.
Please.
And really, yes, the water, the light, float tank, gosh, I know I've mentioned on my podcast before with my folks that, man, it is the best thing for resetting. One of the interesting questions that I get a lot, and I found a lot in my practice with water and changes in pressure, I find that patients with TBIs tend to have some issues with thunderstorms and changes in barometric pressure. Now, have you found that in your personal experience and with patient experience?
Totally.
And
for sure, particularly in that acute TBI recovery phase.
Okay.
Because the brain is bruised. Essentially, it's kind of like if you sprained your ankle or dislocated your elbow, which I did once, and it was extraordinarily painful. And for a while, that entire joint capsule was inflamed. And when the pressure would change, it would be an acute inflammatory response. Similar to sometimes when people are going through different pressure zones, they may have a trigger in a neuroinflammatory cascade that presents itself like migraine headaches.
Okay.
Or some kind of vestibular challenge, like being disoriented or a little bit off in their visual spatial sense. So everything gets heightened when there's an acute injury and the injury is healing. So the recommendations, obviously, for an acute TBI is no more contact sports for a particular period of time, and there are various holding off of playing or return to play protocols in the sports arenas. So for a significant concussion in mixed martial arts, it's usually 6 to 12 weeks, no more combat. It's different between hockey and NFL, and some of those protocols are even getting more and more sophisticated and important. The NFL just really mandated a more strenuous protocol this last year, and they're taking a lot of heat for the research that is obvious that shows the significant long-term effects multiple concussions, looking at that CTE or early Alzheimer's picture, this traumatic encephalopathy that happens over time, that is an accelerated dementia-like brain picture that you can only see on autopsy in some of the NFL players and other high-profile athletes that have committed suicide because they wanted their brain to be examined. There's like the most recent article showed that there was like 99% positive prevalence for CTE in long-term NFL athletes, and some of those early changes are even being able to be seen now at the college level, right? So with early adulthood, while the brain is actually still forming. So when we're looking at like the broad-based implications, it makes a lot of sense to have strict guidelines in place, because the brain is going through an acute inflammatory process. It needs a lot of rest, and that includes rest from anything stimulating. Bright light, loud sounds, pressure differentials, like you mentioned, strong Wi-Fi or EMF exposure. So a lot of computer time or screen time tends to inflame an acutely traumatized brain even more. And so there are things to avoid, and there are also things to do immediately afterwards. And those things would be like acute neurocognitive restorative protocols, high-dose essential fatty acids, fish oil. I'm a huge fan of CBD, or the non-psychoactive component of medical cannabis. Now, the federal government still wants to hold CBD in Schedule 1, and there's a whole discussion that we could get into about that. But suffice it to say, some people have more availability in their local state political arena for CBD and the accessibility of it. What we have seen when people have used CBD in acute TBI restoration programs is extraordinarily beneficial responses in being able to soothe the inflamed brain. And that's not only in acute care conditions, that's also in chronic care conditions. It helps to restore sleep architecture. It helps to settle that sympathetic overdrive. So it's particularly supportive for anxiety-like spectrums. Whether they're connected directly to TBI or not, I'm a fan of using CBD in brain management protocols. And then other things like curcumin or the active form, the medicinal component in turmeric, accelerated response rate when you add black pepper to that, acid, phosphatidylserine, and choline, judicious use of vitamin C, glutathione, particularly in liposomal forms, because there's a much better absorption rate and delivery into the cell itself. So we get into these advanced targeted supplementation protocols in an acute care management setting, and then over time, as the brain heals and kind of gets back its optimal function, symptoms start to normalize, then we move into a more of a maintenance protocol. Just like we would with anything. If there's an acute injury, you have an acute injury repair protocol. As that injury subsides and heals, you move into a more maintenance protocol.
Gotcha. Oh, that makes perfect sense. Now, going back to the CBD, of course, I'm in Washington State, so we have liberal usage of these products. Do you have any data or, just experiential data, doesn't have to be research data, on where someone might start with the CBD? Because unfortunately, the issue that I have with a lot of folks is how many milligrams? Do we do 200? Do we do 500? Where do we go with it? And ramping things up, do you have any suggestions in terms of looking at CBD and how to do things?
Yeah, it's super individual. Mm-hmm. It's phenomenal. I was running a clinic once where we were helping people transition off of psychiatric medications onto more targeted supplements, balanced lifestyle programs, psychological healing, kind of early trauma wounds, the whole compendium. And one of the things that we were using when people had a history of epilepsy or severe mood swings and they were on these long-term anti-epileptics like Depakote or Tegretol, either to manage their seizures or their mood swings, is CBD was really helpful in that. And we were using like 200 to 300 a day. Now, if I use personally like 5 to 10 milligrams a day, I notice it.
Mm-hmm.
And it kind of it soothes the mental chatter, drops me into more of a presence state. So it's good to stack on other nootropics like caffeine, or nicotine. Coffee and smoking, we could call those the two most widely used nootropics on the planet because they both help with attention and focus. Mm-hmm. They have their downsides. Coffee tends to be acidic. Smoking and cigarettes tends to be laced with all kinds of carcinogens. So they're not optimal unless we mitigate the side effects. And one thing that can happen with people who are into a coffee diet or getting into more of like what we could call like a bulletproof approach. Mm-hmm. Like Dave Asprey's really famous for optimizing butter and MCT oil and coconut oil into his coffee regimen in the morning. And there's a lot of understood and validated clinical use for that because the fats level out the caffeine spike. And some people don't like the jitteriness of coffee, but they like the ability for it to turn on their brain. Caffeine really does turn on the brain. And something like CBD can kind of normalize or mellow out that kind of jittery focus. But people with a history or an experience with anxiety tend to be negatively impacted by caffeine, right? So what are the other novel nootropics that we can bring in to utilize for up-leveling attention and focus without significantly stimulating the sympathetic overdrive or kind of like putting too much jet fuel in the car? That's where we get in the sophistication of alchemy and this kind of medicine-based protocol where people who know the variety of options can counsel or coach their clients to use the best protocol that's targeted for them. Mm-hmm. So coming back to CBD, sure. CBD tends to be up-leveled through a bit of use too of THC because they're both primary constituents in the plant itself. Mm-hmm. So it might be on like a 20-to-1 ratio CBD to THC. Yep. And I work with clients in a variety of different peak performance areas as well as transcendental areas. So oftentimes people have reached a level of healing. So when we're looking at full spectrum medicine, it's another platform I have where there's 5 different levels that people opt in for healing. Baseline protocols, which is like acute care management, triage, allopathic, ER, and OR care. So once we've stabilized the acute issue, then they move into level 2, which is the healing arts, naturopathic, chiropractic, Eastern, Ayurvedic, a variety of different compendium of acceleration, just peak performance. Mm-hmm. Most people, when they hit peak performance, they think, okay, well, I'm successful in my work, I'm successful in my relationships, and yet I still think that there's more for me. I'm not totally fulfilled in my life. And then we move into level 4, which is the transcendental experience or the state of really up-leveling consciousness and having that as the primary goal. So oftentimes when people are moving in that arena, they're using plant medicines to accelerate the evolution or the personal development of one's consciousness. And that's a whole nother description of being able to do that in a good way, the right use practices, preparation, and integration. But suffice it to say, when we're using plant medicines, it's helpful to have the whole constituent of the available active components. And there's a reason that the federal government, through the NIMH, has 2 medical patents for cannabis. One is an antioxidant and one is a neuroprotectant. There's a reason that those patents are in place, and so it's still hypocrisy for medical cannabis to be in Schedule 1. Yeah. Because Schedule 1 means there's no medical benefit, and it's highly addictive. So cannabis fails at least in one of those categories. You can make the claim, and I think that it's valid, particularly from my perspective. I was addicted to cannabis at one point, and it does have that addictive component. That's a whole nother discussion, and I understand some people have really charged feelings around that, but we cannot there's no mistaking the evidence that cannabis has a place at the table of healing modalities, and it's up to us as skilled clinicians on the frontier line of medical therapies to understand its right place, its best indications, and how to maximize its efficacy while minimizing its side effects. So that's a long, kind of winded answer to your question about cannabis, but it also highlights all of the therapeutics in the Concussion Repair Manual, because every therapeutic has its sweet spot. It has its active therapeutic window. If we don't use enough of it, then, or we use too little, there's no benefit or not an appreciable benefit. If we use too much, then it becomes destabilizing, out of balance, and potentially poison. So just like water can become poisonous if you use too much, light can, energy can, all of it has its sweet spot. So we as associated frontier medical technologists, so to speak, in this arena, we have the opportunity to bring together the best associated data and research tools and techniques for the most sophisticated protocols on behalf of our clients.
Absolutely. No, this is great. This is just great. So I want to go back to you were talking in the beginning about the five, the big five, and we mentioned water, and we mentioned light, and we mentioned the nutrition and energy. And then we've kind of gone through the different phases that folks recover. I think one of the biggest things that I have seen in my practice is that a lot of people think that they're being wimps by saying they even have symptoms. Obviously in your book, I'm sure you're mentioning things of this nature, but for folks that are listening to my podcast right now and they have had brain injuries, but yet they're like, oh, I'm functioning, I'm fine, nothing, no worries, I'm good. And they're going to say a psychiatrist or a counselor or somebody of that nature, and they're getting antidepressants, maybe even from just their primary care doc. What would you say to someone who is kind of in a state of not wanting to complain, thinking, trying to debate, is there really something wrong with me? Is there not?
Great question. Number one, radical self-compassion. Mm-hmm. And number two, radical, or what would they would call in AA or Alcoholics Anonymous, is a deep personal inventory. Mm-hmm. So we have to, first and foremost, get over our shame and guilt for something that's not immediately obvious. And that's a whole cultural program, especially for men in combat sports, mm-hmm. or veterans coming back off the field or off of the battlefield. Many will say that the post-traumatic stress or the traumatic brain injury, the negative cognitive and mood associated effects after a major trauma or injury is worse than losing a limb, because you can't see it obviously on the outside. It's the same kind of thing for addiction. My dad's and my granddad's generation, it was like a pick yourself up by your bootstraps, stop complaining, get back on the horse, head focused, eyes down, do the work. Yeah. It's a very masculine orientation. It's very archetypally masculine driving force to just push through. And while that has its place, it doesn't have a really compassionate ear for listening to the more subtle yet profound experiences that happen when the brain is injured. And I've done a lot of work personally on my own kind of will to pull myself out of the pit of despair when I've been in long time experiences of suicidal depression. There was about a year where I didn't want to take medication. I didn't want to run from it. So I just sat and looked at it, lived in a tent for a year, willing myself to come out of this pit. And yes, it's possible. So there is something to be said for just kind of like one step in front of the other, chopping wood and carrying water and just doing the work. But it's also heavy lifting when we're using our mind to will the building blocks back into place. Maybe that was also just time and sleep, and my brain healed on its own. It certainly offered me the opportunity to get really humble, get my ass kicked a little bit, and practice meditation and breath and personal responsibility. So I wouldn't have changed it, yet I know it really up-levels the game and accelerates the healing when we have the opportunity to come into that experience, because any healing crisis is an opportunity for transformation. Mm-hmm. Whether it's some horrendous trauma, some life-threatening infection, some like knock you to your knees, ongoing polysystemic flu strain that we've never seen before. People are going through a lot of chronic ailments. Those are all opportunities and doorways to transformation. Crisis precedes transformation every time. Mm-hmm. And while we're going through that process, there are ways to make it easier on ourselves, like taking nootropics and up-leveled therapeutics and getting our brains back online as quick as possible so that we're not suffering for years, but we're more like going through the process for weeks or months, because the brain is the most complex system that we know in the known universe. And it has a whole lot of potential doorways into the healing experience. So the manual that I put forth is just a buffet of options, and there are certainly more options to explore.
Absolutely. Absolutely. In terms of someone that, yes, is going through this crisis currently and is trying to kind of weed their way out, obviously, number one thing that I'm going to be recommending now is for them to grab your book and get started with that and work through it with them. My other question to you in terms of these folks, because this is what I typically will see, like I had mentioned before, is, a lot of folks, I deal with a lot of military because I'm here in Tacoma, Washington, and we've got Joint Base Lewis McChord right next door. And so many folks coming in and, their symptoms are all there. They've either had, an IED explosion kind of injury or things of that nature. And for me, it's that denial, that all that, try to push them through, that just struggling to not admit, but like struggling to get out of that denial, or struggling to get into this case that, like, yes, there really is a problem here. And so I noticed you do a lot of work with transcendental medicine, and I noticed in terms of Peru and some ayahuasca experience and things of that nature. Now, do you recommend that going that far at the beginning, or is this something further on, since it's kind of more of the later phases that you've described to me? Or for someone who's really going, I need some help like right now to change my brain and my attitude, what would be your first response to someone in that case?
Great questions. Let me answer the first one.
Sure.
In regards to the entheogenic medicines.
Mm-hmm.
That also is a very individual specific case-by-case kind of recommendation. Mm-hmm. I know people who have been in the acute TBI recovery phase who have experienced medicines with enormous, incalculable benefits. Mm-hmm. And there does not seem to be, as long as somebody has been stabilized in an ICU setting and they're not like in a severe acute TBI process, they've been stabilized, they're able to eat on their own. They don't have a G tube. They're not intubated. They're not like in a really high medical need. As long as that's not in place and that there's no known history of psychosis or mania or depersonalization, then the risk-benefit ratio is extraordinarily high in the benefit potential when using something like ayahuasca. Okay. Ayahuasca works as the earliest known antidepressants formulated. It up-levels neurochemistry. There is a healing experience that happens. It rehabilitates the serotonergic neurons in some capacity, because people who have had chronic depression, there are case reports, have gone into a medicine experience, Aya, peyote, San Pedro, even iboga or ibogaine, and come out changed with that depression resolved for good, even followed up months later. So there's something that happens, and yet it's difficult for me to make that blanket recommendation, again, because these medicines, unfortunately, are still in Schedule 1. That's changing. Psilocybin and MDMA are right now going into phase 3 trials for chronic depression and chronic severe PTSD or post-traumatic stress disorder. These medicines have their place. So on the safe side, I usually recommend being more in the moderate time frame of acute care
Okay.
management from a TBI.
Okay.
And doing the other things that we know are helpful first, up-leveling nutrition, meditation, taking some targeted supplements, finding out like what the process is like, getting to know the new self in the midst of the tragedy, and then making a really set intention on what the desired outcome is, and then finding good facilitation. You know, that's a much larger discussion and conversation.
Absolutely.
And the first thing before all of that is to acknowledge that there's an issue.
Mm-hmm.
So take a brain test, take a post-concussive syndrome questionnaire, see if there's something offline, and if there is, then trust it. It's not weak. There's no such thing as a tough brain, and it's really hard to will the brain into a healing mode just through focus alone. We need the supportive technologies and therapeutics to harmonize and up-level the entire engagement, including motivation, to be able to utilize the experience of a transcendent state and therefore be able to integrate it back home. Because if the brain's flat already in its neurochemistry and its kind of motivation, it's really hard to implement everything that was experienced in a medicine arena back home in the integration phase and like actually make it workable. Yeah. So this is where we get the opportunity to have these kind of conversations. I'm developing online platforms that are probably going to launch next month, where I'm just offering this kind of information on a question and answer kind of arena. There aren't a whole lot of docs who do TBI recovery and psychedelic medical research, so I'm kind of in a niche area, and I like that space. And so it also helps to know that there are people available like myself and others who just the layperson can ask questions to directly. So it'll be a webinar, kind of teleseminar based format, probably on a weekly time frame. And then you and I can certainly continue these kind of conversations as the protocols get even more sophisticated and developed. And my hope is that the manual itself also spurs a lot of interest, and that we develop the community online platforms that people are able to share their healing experiences. And then when they move through a healing experience, then perhaps there's a community level of support that they become mentors to others, and it feeds back on itself.
Absolutely. That is perfect. That is what we need. That's what needs to be happening for sure. Now, I know that time is short and you need to get going. I would love for you to tell everybody where you can be found and where this Q&A online sessions may be found, and what's the best way for folks to get in touch with you and find you for more information, because your blog's awesome. I read a ton of it, and I think that you've got a lot to offer.
Thanks, Janine. I have essentially 3 parallel platforms, and I'll be speaking through channels on each, and some of them will have different areas of focus. So one is concussionrepairmanual.com.
Okay.
That's where people can go get the book, and we'll also have a library of other expert interviews in these different therapeutics on healing the brain after a concussion. I'll be doing Q&As through that platform as well as fullspectrummedicine.com, where we're talking about TBI, and we're also talking about those 5 phases of opting into a healing and recovery protocol that includes transcendent experiences and how to optimize for those. And then drdaningle.com is my primary practice, where people can opt into for one-on-one work, as well as coming into small group roundtable discussions. I do peak performance training with a variety of different executives and CEOs, and those are more mastermind programs. Mm-hmm. But the ones for clients going through healing opportunities, it's also nice to have a small group framework, because people recognize that they're not doing this alone. There are other people who have similar experiences, and it starts to weave the network and synergy of support. So those are the 3 platforms. They'll get developed more and more over time. I'm kind of launching all of them in parallel. And so those are going to be added to over the next probably rest of October and into November.
Perfect. I love it. Yeah, we definitely need to chat more, because I want to pick your brain more on neurotransmitter testing and, of course, the nootropics, because I'm kind of convinced that, yes, we have a huge problem with traumatic brain injuries, but I also think that a lot of us have caused our own traumatic brain injuries based on our food and all the other things that are happening in the environment. And so I'd love to pick your brain on that as well. So I really appreciate you coming on, and we are going to be in touch, that's for sure.
Excellent. I look forward to it. It's been a great conversation today, and I welcome the further conversations in the future.
Sounds good. Thank you again. You take care.
All right. You too, Janine. Bye-bye.
Thanks for tuning in to The Health Fix, the podcast all about taking control of your health, rebelling against aging, and having fun every day. A lot of patients ask me, do you think I'm aging too fast? So, I created an evaluation checklist for you to see for yourself. Plus, I created a resource guide to help you slow down the aging process right now. You can find it for free on my website, drjkrausnd.com. If you like this podcast, help get the word out to others by liking it and rating it. If you'd like more natural health tips and want to join our Facebook community where I interact daily, click on the Join Group button on our website at drjkrausnd.com.